So today I'm very excited and honored to present the primary results from the high-intensity exercise study to attenuate limitations in trained habits, also known as the HELP trial. While we know that exercise is effective for improving physical function, we wanted to test if one type of aerobic exercise was better. So the primary objective of HELP was to compare the effectiveness of high-intensity interval training versus continuous moderate-intensity exercise on physical function and fatigue. For our study population, we enrolled sedentary older adults at the universities of Colorado and Washington. Of the 111 participants included in the primary analysis, the median age was 57 years, 14% of participants were female, 18% Black, and 15% were Hispanic. These participants were randomized to complete 16 weeks of either high-intensity interval training or continuous moderate-intensity exercise, and both groups completed the same resistance training protocol. We assessed physical function and strength outcomes every 2 weeks for 16 weeks. Our primary endpoint was the % change from baseline to week 16 in the 400-meter walk. We found that both HIIT and CME significantly improved 400-meter walk time, with a 6% from baseline improvement in HIIT and a 4.6% improvement in CME. We also found that both arms significantly improved time to complete the 10 chair rise time, with a 19% improvement seen in HIIT and 15% improvement CME. For strength outcomes, please come to my poster number 15 later this afternoon. And in conclusion, both HIIT and CME, combined with resistance exercise, significantly improved physical function among older adults with HIV. So given that both modes of exercise were equally effective, people with HIV should be encouraged to select the aerobic exercise type according to individual preference. And the biggest takeaway from these very fast 2 minutes is to exercise. And I would like to acknowledge all of the amazing team that I work with on the health trial. Thank you.
Yeah.